So, incidence and prevalence of supraventricular tachycardia. It is not a very common condition, but still it affects 2 to 3 adults in 1,000 people and 1 to 4 children per 1,000 children. The most common mechanisms include AVNRT and AVRT. We're going to talk more specifically about these mechanisms: AV nodal reentrant tachycardia and atrioventricular reciprocating tachycardia, especially for ages between 12 and 30 years old in patients with no structural heart disease. There's also atrial tachycardia and atrial flutter that can be found more commonly later in life, and they are frequently associated with some structural heart disease. So if we wanted to look at the distribution by age of the different mechanisms of supraventricular tachycardia, we will see that the AVNRT, AV nodal reentrant tachycardia in the gray shade, starts as a little less common earlier in life. And it really peaks during the middle age years. So what I frequently tell my students and residents is that if you are called in the emergency room about a 50-year-old woman with supraventricular tachycardia, the chances are that most certainly she has AV nodal reentrant tachycardia, and less frequently AVRT, AV reciprocating tachycardia, which is more common in white color here, more common in the earlier parts of life, and it is associated with the presence of accessory pathways or the WPW syndrome, and atrial tachycardia, which is low prevalence, but it does peak around middle age and is found more commonly later in life. This is a large study from a European center when they looked back at almost 1,800 patients that had undergone catheter ablation for supraventricular tachycardia. And of those patients, AVNRT was the most predominant mechanism in 56% of the patients, followed by AV reciprocating tachycardia in 27% of the patients, and less commonly atrial tachycardia. The majority of the patients with AVRT were men, whereas the majority of AVNRT and atrial tachycardia patients were women. And AVNRT became the most frequent mechanism as patients were approaching middle age and later years. We very commonly hear complaints about women in their reproductive age that they get more palpitations and more frequent episodes of SVT, depending on the time of their menstrual cycle where they are. And most of them report that those episodes of palpitations become more frequent just before their period or during their period. This is confirmed by a small but strong scientifically study that actually studied women during their menstrual cycle, and they did find that right before their period were more prone to develop the symptoms of the supraventricular tachycardia and their episodes. Although this talks more about the management of supraventricular tachycardia, I think it's an important point to make that there are still, up to this day, significant gender-related differences in radiofrequency catheter ablation therapy for SVTs, which, as we are going to discuss later, is really the primary way of managing these arrhythmias. So this is from a study of a large study from Germany in almost 900 patients who underwent ablation for supraventricular tachycardias. females were referred for ablation later than males by many months at the time, and after having tried more medications than men had at the same time. However, this hesitance that referring physicians had to refer their female patients to electrophysiologists was not justified by the success of the procedure or the procedure process. So the fluoroscopy time, the number of radiofrequency applications, and the procedure duration was similar for the two genders, as well as the success rate, the complications, and the recurrence rate, which were similar. So a little food for thought for future management, especially of our female patients.